Welcome everyone to my second video of Medical Talk, my brand new channel here on YouTube. I'm really excited to bring this channel to you. I mentioned in my last video a little bit background on me. I've been an employee within a local hospital for just about 30 years now. I've worked in a few different departments, including emergency room, radiology department. Currently, I'm working in radiation oncology, where we administer radiation therapy to cancer patients. And it's kind of been my long life dream to create a medical online presence where I can present all sorts of medical topics, answer medical questions, and just really dive deeply into the medical topics and issues in today's society. So I'm glad that you're here. I'm going to be reviewing a few more different topics today that I'll be covering on this new channel, Medical Talk. I'm also going to be doing interviews with people, presenting 10 or 15 videos on each topic and answering questions as we go along. So once again, welcome to Medical Talk. If you like this channel and the information that I've supplied so far, please go ahead and subscribe to the channel and hit the bell notification and turn on your notifications so you'll be notified each time I release a new video. And with that said, let's go ahead and take a look at some of the other topics I'm going to be covering in this channel. Okay, so one of the other topics we'll be handling is heart disease. And here's everything you need to know about heart disease. But again, I'm going to be creating 10 or 15 videos on heart disease and then all the different subtopics with heart disease. So heart disease refers to any condition affecting the heart, and there are many types, some which are preventable. According to the Centers for Disease Control and Prevention, heart disease is the leading cause of death in the United States. Around 1 in 4 deaths in the United States occur due to heart disease, and the condition affects all genders as well as all racial and ethnic groups. So, some of the types of heart disease is coronary artery disease, congenital heart defects, which includes atypical heart valves, septal defects, and atresia. Arrhythmia is another condition of heart disease, and dilated cardiomyopathy is another one. Myocardial infarction and heart failure and hypertension are some others. But again, I'm going to be creating videos on all of these subtopics of heart disease and answering questions as we go along within Medical Talk here. So let's go ahead and move on. Another topic I'm going to be covering is neurology and what neurology is and the effects and signs, things to look out for. Let's take a look at this. If you or a loved one has unexplained symptoms that could be related to the brain or nervous system, your doctor may recommend a neurological exam with a specialist, which is a neurologist. Neurologists are specialists who treat diseases of the brain and spinal cord, peripheral nerves, and muscles. Neurological conditions include epilepsy, stroke, and multiple sclerosis and Parkinson's disease. So, patients may see a neurologist if they have uncontrolled headaches, memory loss, imbalance, numbness, or pain. Okay, so here's some of the reasons for seeing a neurologist: chronic severe headaches, pain, dizziness, numbness, movement problems, memory problems, or confusion. So we're going to be talking about neurology in depth as well, with another 10 or 15 videos explaining and answering questions on neurology. Another topic that we're going to be covering in Medical Talk is mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of our lives, if we experience mental health problems, your thinking, mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, and family history and mental health problems. So, we're going to be going in depth on mental health with more videos and answering questions as well. This is a big one, guys. Just before we move on, here are some of the early warning signs of mental health, and that you could possibly have some issues with it. So here are some of the symptoms: eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless and hopeless, smoking, drinking, or using drugs more than usual, feeling usually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, inability to perform tasks like taking care of your kids or getting to work or school. So we're going to leave this topic at that and move on. But again, if you subscribe to my channel, I'm going to be doing a whole series on mental health, and you'll be notified each time I release a new video on mental health. So with that said, I'm going to go ahead and show you a video on exercise, the benefits of exercise that I created. When it comes to exercise, it's really preventative and helping so many different issues in the medical field, from medical health to heart disease, to your orthopedics, to your bones. Just about everything that we cover, exercise can help with so many different medical issues. So I just want to show you a short video that I created on the benefits of exercise, and then I'll be back and we're going to take a look at two more topics I'll be covering in the new channel, Medical Talk, and then we'll leave it at there and end the video at that point. So let's go ahead and take a look at this video on exercise.
What type of activity, whether it's a cardiovascular exercise like running or an anaerobic exercise like weightlifting, skeletal muscles are constantly being contracted. Serving several purposes, muscle contractions are a necessary function of human movement, offering stability, postural support, and even body temperature regulation. Similarly, exercise, no matter the type, has the ability to aid in any fitness goal of choice, whether weight loss, strength, muscle gain, or otherwise. When a muscle is overexerted during exercise, however, muscle contractions can result in injury or some type of temporary discomfort. In what follows, we'll be diving into the world of exercise, detailing the many things that happen during a given activity and how it can aid in any fitness goal of your choosing. More specifically, we'll discuss what a muscle contraction is, what types of contractions there are, and what occurs when muscles are overexerted. Muscle contractions. Defined by the shortening, lengthening, and tightening of a given muscle or muscles, a muscle contraction is the activation of tension-generating muscle cells triggered when a certain stimulus occurs. The type of stimulus or action that triggers a contraction will determine what type of contraction occurs. Some examples of common actions that trigger a specific muscle contraction include a bicep curl, a squat, and a leg raise. No matter the type, however, all different muscle contractions serve the same purpose. They move certain parts of the body and act to provide stability and maintain proper posture. In addition, muscle contractions will also serve the function of body temperature regulation. Types of muscle contractions. There are three primary types of muscle contractions: concentric contraction, eccentric contraction, and isometric contraction. Though independent in their location and activity, certain muscle contractions often occur at the same time other muscles are contracting. Thus, a given movement will usually lead to multiple muscle contractions. Concentric contractions are when a muscle shortens and generates a force. Eccentric contractions describe a muscle that is lengthening and generating tension. Finally, isometric contractions occur when there is no change in length of the muscle. The different types of contractions occur based on the technique and location of the contracted muscle. During a bicep curl, for example, there's a concentric and eccentric contraction that occurs. In addition, depending on whether or not you decide to hold the weight in a position for a specified duration, there also may be an isometric contraction involved. How a muscle contracts. The contracting portion of the muscle is otherwise known as the muscle fibers. The building blocks of the muscle fibers are proteins named actin and myosin, and when muscle contracts, these fibers either shorten and tighten or lengthen and loosen. The cause of fiber contraction is a nervous system signal, otherwise known as an action potential. Through this nerve signal, the impulse reaches the end plate of the muscle and affects the muscle cells, producing a contraction. A muscle contraction is largely regulated by calcium. For those seeking to improve the efficiency of the action potential generated during a given contraction, it's important to optimize calcium levels in the body through a healthy, nutritious, and well-rounded diet. Muscle spasms and cramps. Otherwise known as muscle cramps or Charlie horses, muscle spasms occur when the muscle involuntarily and forcefully contracts in an uncontrolled fashion. This occurs because the muscle is unable to relax due to muscle fatigue, dehydration, electrolyte imbalance, or perhaps the reason is unknown. Muscle spasms can involve the entirety of a muscle or simply a portion of it. In the most severe cases, a muscle spasm can occur in numerous muscles simultaneously. The most common muscles that experience muscle spasms include the thighs, hands, arms, abdomen, and calves. Though extremely common, it's best to make efforts to avoid muscle spasms by frequent stretching via warming up and cooling down, as well as regular hydration. Common goals of exercise. Most individuals are interested in learning how exercise can help them attain a specific goal. Depending on which exercise or fitness methodology used, almost any given goal can be achieved. Whether it be athletic performance, weight loss, fat burning, strength gains, muscle building, or simply an overall improvement to your health, there is an efficient exercise that can be utilized that is best suited for the desired goal. Someone seeking to lose weight and burn fat, for example, would likely seek out a cardiovascular-based exercise that produces high caloric expenditure. Similarly, someone seeking to build muscle will likely partake in a weight training exercise that maximizes muscle contraction and stimulus. Once the goal and exercise have been decided, it's important also to learn how to maximize efforts. An example of a key component of effort is intensity, which can be measured by perceived exertion or, more accurately, by heart rate. It has been understood that an increase in heart rate translates greatly to an improvement in performance, ultimately improving the overall quality of the workout. Final thoughts. Exercise is a lifestyle component that should be part of any healthy lifestyle. Not only is it beneficial for performance and athletic improvements but for one's general mental and physical health and well-being. It's important to understand the basic actions of exercise, such as muscle contractions, and learn how to improve efficiency of these contractions to achieve the goals of exercise.
Okay, and we're back. Hope everyone enjoyed that video I created on exercise, benefits of exercise, and you can see just a little bit more clearly how exercise can help you with a whole multitude of different medical conditions. And if you tune in to Medical Talk here on YouTube, you're going to see a lot more videos on exercise, different types of exercise, and what kind of exercise to do for different medical ailments. So let's go ahead and take a look at another topic that I'm going to be covering here on Medical Talk, and that's going to be the subject of dermatology. Dermatology is a branch of medicine that focuses on treating skin, hair, and nails. You might see a dermatologist for a yearly skin cancer check, or you may see one more regularly if you have a condition such as acne or psoriasis. And this is just an article in Dermatology. I'm going to be creating the videos on it. You can see a dermatologist for acne, eczema, hair loss, chronic nail infections, just to name a few. So dermatology, that's another subject. The last topic that I'm going to be telling you that we'll be covering in Medical Talk here is orthopedics. Okay, orthopedics is a branch of medicine that focuses on the care of skeletal system. This system consists of the muscles, bones, joints, ligaments, and tendons. A person who specializes in orthopedics is known as an orthopedist. Okay, orthopedists use surgery and non-surgical approaches to treat muscular, skeletal issues such as sports injuries, joint pain, and back problems. Okay, so we're going to be covering this also within videos. And here's some of the things orthopedics covers that I just mentioned. You can take a look at that. And okay, guys, so with that, I hope you enjoyed this video. I'm really excited to get this YouTube channel off the ground here. And I may be creating one more video on different topics that I'm going to be covering. But the list just goes on and on and on. And I think you're going to find a lot of answers to medical things here once the ball gets rolling. I'm really excited to have all of you here, and I really hope that you'll go ahead and click on the subscribe button, subscribe to my channel. You'll then click on the little bell notification and turn on your notifications, and then every time I release a new medical video, you'll be notified that one has been uploaded to this channel. With that said, thanks again for tuning in to Medical Talk, and we will see you in the next video. Thank you.